and shared on the hub. So if you miss anything, want to go back and listen to anything again, you know, you can do that. It will be, as I say, available on the hub. I just ask that you all stay muted, which you all are. Well done. While I'm going through it. If you have any questions, please do put them in the chat, and Bertha, who's one of our committee members, will I'll get her to introduce herself in a minute. We'll monitor the chat, answer questions as we go, and then there'll be opportunity at the end to ask questions as well. And we've got quite a small group today, so hopefully we'll get everything covered that needs to be covered. So Bertha, do you just want to do a quick introduction?
Yes. Hello, everyone. I extend our warmest welcome and wish you a productive and rewarding workshop. I am Bertha Moron Espinosa. I currently work at NHS North East London. I head up the London Performance Analytics team.
Thank you, Bertha. And I'm Jane Johnson, so I'm co-CEO of AFA. And as Bertha, we are both part of the Professional Development Committee. So we're the ones that do all the assessments, or we're two of the people that assess your registrations. Right, I shall get going. I think I'm already sharing my screen. Is everybody seeing that? Just
yes.
Yeah, thank you. Slide show. Where's the slideshow gone? Slide. Well, that's can't see slideshow. Normally it says view. Okay, I might just have to do this because it's not showing me slideshow.
If you go to the bottom right,
oh yes, it's that.
Yeah, the icon. Yeah, you can. No,
there we
not
go.
that one.
Slideshow.
Yeah.
Right, lovely. Thanks, Bertha. Temporary brain fart there. Forgot what I was doing. Okay, so let's start from the beginning. Professional registration workshop. Hello, everybody. So first of all, a quick bit of background. AFA is a membership organisation that comes under the umbrella of Federation of Informatics Professionals. Now, FedIP, as they are known, is the governing body, the umbrella organisation that we are accountable to. They hold the professional register. So AFA is just one of their member bodies. There's other membership organisations fall under FedIP, such as BCS, IREM, Chime, Soccertim, and a number of others. And they all do their own version of professional registration that's relevant to their membership and their profession. But the actual registration, if you go through this process, following the AFA professional registration, you will go on the FedIP register, and there's a very, very small screenshot there, and the public register will show your details, your name, what level you're registered at, and it also has, you can't probably see it, which institute you are with, whether you are AFA or BCS or whatever. So the FedIP register covers everybody. As an AFA member, obviously you pay your membership of £37 or £47 a year. Once you become professionally registered, you also have to pay an annual registration to FedIP of £25 a year. Your registration lasts for 3 years once you've gone through the process, and as long as you are still maintain your AFA membership and maintain your FedIP annual registration fees, you will remain on the register. So the registration is the AFA itself. Obviously, we have been set up for data and informatics professionals, data and information analytical professionals. and we are licensed by FedIP, as we've already said. This is a registration route for analysts. If you went to something like the BCS, apart from the fact that it's an awful lot more expensive than doing it through AFA, it's quite generic within the IT skills, whereas the AFA registration is quite focused on your own skills within health and care, analytics within health and care. And the registration standards have been tailored under the FedIP rules for that profession. The National Competency Framework, I will just mention this. So the National Competency Framework is AFA was originally commissioned to develop the National Competency Framework, and I'm sure you've all seen presentations by Sarah Blundell and Andy Lavelle of the National Competency Framework. We were involved right at the beginning, and then NHSE obviously have taken it back and grown it from there. So a lot of the phrases, a lot of the wording you see in the National Competency Framework are very similar to what you will see in the AFA registration standards, because AFA was kind of involved, obviously, in compiling both. The difference is the National Competency Framework is, we call it the toolbox. These are the competencies you need. The National Competency Framework is set out with different bandings, different grades, job grades. It's an indication for what you would expect your skills to be at a certain grade. So, if you were looking to go for a job at band 7, you might want to look at the competency framework and see what sort of skills they would be requiring at that grade. But obviously, as with, any job that you go for, nobody's necessarily got 100% of everything on a job application, on what's required for it, a job description. It's just a set of tools that gives you something to work towards, and it helps you with your professional development. So where the professional registration comes in, that is for you to demonstrate your competencies as using those tools. It's nothing to do with your job title. It's nothing to do with your grade. It's nothing to do with your academic background. It's just saying that these are the standards, you are demonstrating that you have the skills to be able to apply to your job and carry out those, use the tools safely and appropriately. So why would you want professional registration? One, it's actually quite a good confidence boost. You can demonstrate your skills and your competencies. I'm sure you've all been in a position as well at work. It's not so bad now, but it certainly used to happen where you'd have managers coming along saying, this is the answer, now give me the analysis to prove it. We're professionals, and they have to remember that. As with our clinical and finance colleagues, we would never, you'd never come up with such a suggestion. So it's a validation of your knowledge and skills. Your skills and competencies have been absolutely validated and peer reviewed. It shows your commitment, and it gives you that confidence to be able to say to people, you're professionally registered, and there is a code of ethics that all professionally registered staff, whether they're clinical, financial, or data and analytics, have to follow. And it just gives you that ability to be able to say that you can do your job, and your managers can be confident that when they make their decisions based on the insights and the intelligence that you're providing, that it's been done with competency. There's different levels to think about. So there's an associate practitioner, which is for people new into the NHS, new into the profession, who maybe don't have enough of the skills to go through a full registration process. So associate practitioner is really just an indication of, this is where I am, this is what I'm doing. I would like to do professional registration, and I promise that within 2 years I will go through the full registration process. We're also looking at another level in between there. But at the moment, we've got the associate practitioner. Then we have the actual practitioner levels, practitioner, senior, advanced, and leading. Now, again, it's nothing to do with the band you are on. It's nothing to do with your academic background. It's nothing to do with what your job title is. If you can fulfill the requirements within the standards for any of those levels, then go for that level. You do have to fulfill all. So if you say applied at a senior practitioner level, and some of them you think, oh, I actually hit advanced practitioner, unless you can do advanced in every single standard, you have to go for the level where you can apply to every single standard your competencies. But it does give you something for your personal development plan to work through if you want to go for a higher level at another time. You have to use the registration documents we provide, and they are all available on the AFA website. Again, sorry, it might be a little bit small. This is what you will see on the AFA website, and you can click here for further guidance. It will give you examples of reflective practice, which is one of the elements of the registration process. Lots of frequently asked questions, and you have to click here for the application form. Now, what this will do is actually take you through to the Fed IP hub, because being the governing body. If you do that, and it will ask you for all your information, you don't think, oh, I've suddenly got to apply now. You don't. Once you've, it says click here to apply, but basically you're just going in there to register yourself so you can get all the documentation. But when you do your registration, actually go through the full process, you might do it in the next round, you might do it because it's a quarterly cycle, you might wait to the next cycle. So completing the application itself, I've kind of said this already, this is the page you'll get, the Fed IP registration, that you have to fill out, and then you can download all the forms that are needed. So there's an application form which shows all the standards, and there's some boxes there for additional text if you feel you haven't covered in your reflective practice, and there's reflective practice template for you to use. You can map all your standards to your reflective practice. I'll show that in a minute. And if you go through reaccreditation, so after the 3 years, if you just want to renew at that level, it's not as onerous a task. The first time you apply, you have to, go through all that, and you have to apply 3 reflective practices. If you're doing reaccreditation, you just need to do 2 reflective practices and a bit of evidence on CPD, as opposed to having to evidence all the standards again. But if you are accrediting at a different level, then you have to go through the whole application process again. So the different standards, it's very difficult to do a wiggly line freehand. So no comments, please, unless you can do better. So think of it as a journey through the standards. So the first standard, where you see P, that just means practitioner level. When you go onto your application form, if you're going for senior practitioner, it'll have SP. That's the actual standards wording is exactly the same. What is different, and I'll show you in a minute, is the amount of information, the evidence you have to provide. So think of it, you've got a bit of work to do, a bit of analytics to do. So first of all, you think about what methods would you apply? Then looking at the methods, how would you use them to solve the problems? What are you doing to solve the problems? How are you planning and organizing this piece of work? And so these standards are the blips on the corners on our little roadway. Certain amount of autonomous practice, which obviously varies depending on what level you're going for, demonstrating accountability and responsibility, communication and collaborative working, how you can demonstrate that, and continued professional development, how you can demonstrate your continued professional development. And there is another standard in there that you will see, which is demonstrating professionalism, which I will show you a bit more. So going into the standards, see here, I've got SP because this is a senior practitioner level I'm showing as an example. So applying methods. The competencies: undertake health and care data and/or analytics tasks relevant to your specialism, identifying, selecting, and employing appropriate methods, tools, and procedures. So this guidance shows you how would you describe that? How would you actually show that? So you can start off in your reflective practice describing a situation in which you've undertaken the analytics task within your specialism under your own direction. So what was it you actually did? How did you choose the most appropriate methods? And what happened as a result of the work? How successful were you? And again, using methods to solve problems, applying the appropriate methods to identify and address complex problems. So what were the problems? How did you apply the methods? And what were the results of your actions? Organisation and planning. I won't read them all out, but how did you identify resources available? How did you ensure efficiency whilst managing safety, security, and quality? So you might be looking at your IG, your DQ, and what were the results? Autonomous practice. This obviously varies a lot depending on your job and the level you're applying for. But can you work reliably and effectively without supervision? Bearing in mind this is a senior practitioner level, so the practitioner level would be slightly less of an ask of what you have to do. Supervising others, what codes of practice, ensuring effectiveness and outcomes, accountability and responsibility, accepting responsibility for work of yourself and others where appropriate. As I say, the different levels will have slightly different competencies and guidance, but the headings will always be the same. And then the final ones, there's 9 standards in all. So communication, what communication methods did you use? How did you employ appropriate terminology? Bearing in mind was do a lot of acronyms with our CDSs and everything else. We have to be sure that our audience understands that. Collaborative working, did you work with other colleagues in different departments, operational staff, clinical staff, suppliers, public, whatever? And what were the challenges? What actions did you take? This is the demonstrating professionalism, which I mentioned, and this is complying with the Alpha Code of Conduct. Now, I did say earlier on about we are professionals and we work to certain standards and ethics, and we even include here a hyperlink to the Alpha Code of Conduct. If you look at that Code of Conduct on the website, it says this is the one people trip over and think, oh, how do I evidence that I'm that I'm sticking to a code of conduct? So describe situations in which compliance applies. Have you ensured compliance? The code of conduct has things in there like maintaining high standards of professional and technical competence. So maybe you've done some training, some CPD to improve your technical competence. So a certificate would do that. There's things like, refusing personal inducements and all that. Of course, you can't evidence that, but there's observed duties regarding protecting security, confidentiality, accuracy, integrity of information. So maybe you do everybody does their annual IG security training and usually get an electronic certificate. So that would be evidence of doing that. We don't require, tons of evidence for each standard. We just want one or two pieces. So as long as you can attach a couple of things, we're happy with that. And continued professional development, showing evidence that you are continually professionally developing. Now, I've obviously mentioned that in the Code of Conduct, maintaining a high standard of professional and technical competence. If you've done a course to up your competencies, your technical skills, that piece of evidence can actually cover both the demonstrating professionalism and continued professional development. So you can use one piece of evidence to cover more than one standard. It doesn't necessarily have to be separate bits of evidence for every standard, as long as every standard is evidenced in some way by the end of your application. So there's also a section on contextual standards. Now, this is how you understand your position, your job within the overall system. So how does your job impact on healthcare? Awareness of other sectors that you work with, the terminology that you use, healthcare informatics, information governance, GDPR. You do probably your GDPR training each year as well. You might go to meetings, IG meetings. So, minutes from IG meetings or meeting invitations. So there is a section on the application form because these are very difficult to evidence or to bring into your reflective practice. We recognize that. However, on the application form, you can write more in that regard in the boxes available there if you can't fit them into your reflective practices. As long as you tell us about them in the application, you might be able to bring them into reflective practice as well, and evidence them. So which level are you going for? You will find a matrix that shows you the different levels: practitioner, senior, advanced, and leading. And here you can see what the differences are. I won't go through them all. This is all on the website. So, for example, a practitioner level exercises autonomy subject to overall guidance and direction. So your boss has given you a piece of work and you've gone off to go on and do it, and you go back to them and say, right, I've done this, I've done that, and they just check and say, yeah, carry on with that. A senior has a little bit more autonomy within limited parameters, and they might actually have responsibility for the work of others, whereas a practitioner wouldn't necessarily. Advanced practitioner, much broader scope of autonomy, building more business relationship and applying fundamental principles. So each of these just goes up a step as you go up the ladder. And obviously a leading practitioner just has they probably manage an entire team that report back to them. So much broader autonomy. Now, for the lower levels, there's actually, you'll find a lot more technical things are being asked, like what method did you use to run this analysis? It might be what code you used. Some of the leading practitioners, I'm a leading practitioner. My job is much more strategic. I tend to oversee and write strategy for and target operating models for how BI teams would work. I've been an analyst. I did 30 plus years in the NHS in data and analytics. So, I started as a baby analyst and I've done all that, but I haven't written a piece of code probably for about 2 years. So I would struggle to actually cover some of the other ones that would require more evidence of the technical skills that you guys might do every day. So there is a place for everybody in the different levels. So here's an example of a piece of work that you might use for your reflective practice. So think of something that you've done. It's a good idea to keep going all the time doing this because it works, it helps you with your own personal development. And if you keep building things up and keeping folders of stuff, then when you do go through to do your registration, you've got it all there. So picture you're an analyst supporting a medical directorate. The elderly care directorate wants to look at establishing a frailty service, so you're asked for analytical support. So you've done some research and learning around frailty and how do you measure that? And then you have a look at what data is available. So as a result of this piece of work, you've helped to improve the identification of frailty by maybe adding a flag into your information system, to your EPR, and analysed the data and presented it in a visual way so the customers that you're doing this piece of work for can easily understand it. And your analysis ultimately supported the creation of a frailty service. So to write up this experience as a reflective practice, we use the STAR approach, which is situations, tasks, actions, and results. So you need to look at your core professional standards, which is the methodology, the organization, accountability, collaborative working, communication, etc. And then the contextual standards that you have to consider as you're working through your reflective practice. But as I say, you might find some of the contextual standards a little bit more difficult to work in. So using the STAR technique, situation, task, actions, and results. So writing it up as a reflective practice, bearing in mind these are your standards here. The situation, you were asked to join a newly established multidisciplinary, can't say that, frailty core team as a data analyst lead to support the establishment of a frailty service. So collaborative working, you're part of a new multidisciplinary team. You've put SP2. So if you put in brackets what standard you are addressing in your reflective practice, and C2, awareness of sectors, because you're working across sector on the frailty team, and that's giving you a good understanding of how it works across the different pathways. So in order to help implement the team priorities and work streams, as an organisation, you signed up to the Acute Frailty Network programme, working alongside NHS elective care. You haven't really covered any standards there, but it's part of what you're doing. That's fine. You keep it, it's, you know, short bullets so you can follow what you're doing. And I would also suggest try and do a reflective practice all in one go. Don't keep going back, otherwise you'll forget where you got to. So you attended workshops, discussions, and measurement meetings with colleagues to gain knowledge and understanding of different measures and tools. So SP9, that's continual professional development because you've been going to workshops. Now, what I would suggest is here for evidence of SP7 for your collaborative working, I'd say keep a copy of one of the agendas or a copy of the minutes or something like that that shows you are part of that team. For this SP9, which is your continued professional development, have you got any, I don't know, Eventbrite invites to workshops or certificates showing that you attended a workshop, or even, you know, an email confirming your place at a workshop and your attendance? So all evidence can come in many ways. Evidence isn't about the output and it's not about the code you write, although there are places for that. Really think about how are you going to evidence that, and very often it's a certificate, an email, a set of minutes. It might be a slideshow you presented at a workshop that's got your name on it, but it has to be able to be tied back to you. So it became apparent there were many different approaches to measure the cohorts, and the expectations were different. So after several meetings and workshops, decided we were able to identify how we were identifying frailty and present the data using a series of charts. And once the data was collected, we used SPC. I wanted to use Pareto chart as the theory that goes to affect change. You should need to concentrate on the top 80%. So applying methods, this is you saying I've applied the method. So here you could put in your output of an SPC chart, or you could put in your output of the Pareto chart, the final analysis, and that is showing application of methods and how you've used the methods to solve a problem, SP2. So that's just the situation. Going on to the tasks. So you attended several meetings. forums with analysts and we discussed best practice. That's using methods to solve problems again. So you've covered SP2, but you've double covered it here. Then it became clear to identify and measure the different pathways. Looking at clinical frailty scores would be required, and how to attribute to the front door when the patient attended A&E. So this is a bit of autonomous practice here. You've had to look at how this is done, and you've established. So maybe you've got an email to A&E about how this can be collected, or an email somewhere to show that this is your thinking and this is what you suggest. So again, it might be an email for that evidence. Then you need to write various SQL scripts to pull the correct data from the warehouse, applying methods. So your evidence is a screenshot of a bit of your SQL script. Doesn't have to be the whole thing, because obviously sometimes they can be very long. And your understanding was limited on the definition of frailty, so you went to a series of meetings to improve knowledge. And then you shared that back with your colleagues. So actually, you've done collaborative working here. You've been working with your colleagues and sharing knowledge, and you've also done organisation and planning. You've thought ahead. I need to know more about frailty. So an invite to the frailty workshop, a certificate from the frailty workshop, or maybe you've spoken at a team meeting about frailty and you're on the meeting agenda, you're tabled on the agenda. So again, all bits of evidence. And then you developed a series of charts to meet the needs of the stakeholders. Communication, how you've communicated back your findings to the stakeholders. Actions, so you attended 2 half-day measurement courses, identifying frailty. Now here, just in this one action, and obviously, you've seen that you've already mentioned these on the situation and the task, but that's fine. It keeps your head together and you can follow what you're doing. So it shows about how you've applied methods. You've used, autonomous practice, that you've taken the initiative to do this. You've shown your accountability and responsibility in creating the relevant metrics, and continual professional developments because you've been going to workshops. So you wrote several SQL scripts, and discussion with some training with the business intelligence team to establish which tables to link, which been added to the data warehouse. So again, methods applied and continued professional development. Then to meet the needs of all, you created a series of pivot tables, compliant with all the requirements, the data items that were needed to look at how they could drill down to patient level for further analysis. So you've covered the methods again being used, and communication, how you communicated back, and the bar charts again, methods to solve problems and communication. Presenting the data, you've covered an SP6 here, communication, how you've presented it, and C3, terminology. Make sure in your presentation that you have explained acronyms, etc. So evidence for that might be the presentation that you presented the data at a measurement call. So you can show that as your evidence for those. You undertook training in Agile and Scrum to help you with the planning. So you're looking at organisation and planning and continued professional development, and taking responsibility for addressing data quality issues while you work through this. So again, autonomous practice, you took that initiative and accountability for the quality. And then the results finally, the frailty team were happy with it. NHS Select were impressed with the work that had been done, and they acknowledge you now identify frailty well and have qualified the need for the service. So impact on healthcare. That email from NHS Elect acknowledging that is your evidence to show your impact on healthcare, and what methods you use to solve the problems. So as an organisation, you can track the frailty. So the patient identifiable data was handled with, in accordance with GDPR, information governance guidelines, and you took accountability and responsibility for that. The final bit we ask on a reflective practice, it probably is quicker for you to write than it is for me to talk through all this. This is what it ultimately looks like. I've done it page by page so you could see the different standards as we work through, but ultimately this is your final result. And in this first reflective practice, you have actually covered all of the standards apart from SP8, which is with regards to the AFA Code of Conduct, which I explained to you earlier. So you have to do 3 reflective practices, and you're going to be covering all these standards again. But that's fine. We need 3 reflective practices. But do you see what I mean? You've already covered it all. You haven't covered all the competencies, the core skills, the C standards, but that's fine because not everybody can in their reflective practice, but there's space on the application for you to do that. Then we just ask for a 1-page again. What went well? What went less well? What did you learn? And what would you do differently? This is showing that you are developing yourself. So it really is quite important to do these. Don't be scared about, well, this didn't go, be honest. Things don't always go well. And we want you to say what hadn't been well because it shows us that you are thinking about how did you learn from that? And what would you do differently next time? The evidence I've kind of gone through as I've said it. There you have to upload the evidence when you're saving your evidence. Make it quite clear. Get yourself a folder and start saving that stuff now, and call it. You might call evidence 1. Certificate for GDPR compliance, evidence 2, MDT meeting agenda, so what it is when you're, and also it makes it a lot easier for us as assessors to be able to link your evidence back to the standards. So this is one evidence example about going to different webinars on different principles. So that's shown evidence of, continued professional development. There's other evidence here: measurement fact sheet, understanding collecting frailty data from the acute frailty network. So you can put all this into your evidence folder, which would cover all sorts of things about visualizations, methods used, expanding your knowledge across sectors, etc. More examples of evidence. Here's a SQL code. It might be an output of a pivot table. So screenshots, are absolutely fine. Again, here we've got more examples of evidence. It might be an email thanking people for their time and how impressed they were with the work that has been done. So there's all sorts of different evidence you can use to cover those standards. Here again, another email following the frailty meeting. I've attached a number of records where patients been seen for conclusion time is after departure time, so resulting in minus calculation. So you've picked up on data quality, accountability, responsibility for the results that come out. Sub-frailty group meeting, again, you can redact stuff because obviously there's going to be areas where there is confidential information, but your name would appear on there as an agenda item to show that you are part of that multidisciplinary team, part of that frailty working group, and how you're looking at the issues. A certificate to say that you've done your IG digital learning program. How many more slides have I got? I might just have to go through those a little bit. Oh, right. Application form. I'm just very aware of time. So This is the application form. We don't ask for a lot. Short profile, any conferences you might have presented at, papers published. It might be a blog you've done on LinkedIn, any awards you've won, your formal qualifications, career history. Again, like one line, a bullet. We don't want full CV. What are your key duties? Led an information team. It can be really quite minimal. It doesn't have to be huge amounts. The application form shows this matrix. This is why it's good for you to make sure you name your evidence as you go through clearly. So when you fill out this matrix, you can see exactly what evidence you're supplying. So in the example we gave, it didn't cover C4 or GDPR. Oh, actually, it might be a different one. Anyway, oh yes, and SP8 demonstrating professionalism, which is the code of conduct. But you've ticked just about everything here, and you've evidenced all. You haven't managed to evidence autonomous practice, but there's ways that you might evidence autonomous practice through one of your other reflective practices. So once you've done your 3 reflective practices, the ticks, we don't want a tick in every box, but what we want is at least 1 tick in each line. So you can have 3 ticks there, you could have 1 tick there. As long as there is a tick in each line, then we know that you have covered it. And ultimately, there should be evidence against every single standard as well. The next bit, this is the next page of the application form, demonstrating professionalism. As I say, the code of conduct, people can't always put it into their reflective practice. So here somebody has written about how they demonstrate professionalism. You can read all this because the slides will be available as well. And then here, those understanding the domain in a healthcare context. Again, this has been written mostly in commentary because people can't always do it in their reflective practice. So if you can, and here, this one bit of commentary is kind of covered C1 to C4. And again, this bit of commentary is covered C5 and 6. So you don't have to do a line per one, as long as overall we can see it's all covered and the evidence to back it up. And then you get a sponsor to sign it. If your sponsor is a registered already on the professional register, then they can sign off your evidence. We still need to receive it, but they can sign it off for you. And then you get it all put up onto the FedIP hub, and it's submitted through there. This is what you will see. Oh, so we've kind of gone back to, you download the stuff, you download your forms, and then you upload the forms and upload the reflective practice examples all through the FedIP hub, and you attach your files for your evidence. You can select and browse through there. And then if you want to put any accompanying text, you can. Not everybody does, don't feel it's a trick question. It's not at all. And then you submit. And then it comes to us. So we've got the introduction workshop today. The registration window, if you choose to apply, is this quarter, is on the 1st of October. Now you've got some added extras here. The AFL conference will have a workshop on how to complete a reflective practice. So if you're coming to the conference, you've got a little bit extra there to help you out. And then at HET, if anybody goes to HET, there's a dedicated AFA networking session, which will also do cover professional registration Q&A. So these are 2 extras that not everybody gets every quarter. Normally we just go from registration window opens to halfway through the month we have a Q&A workshop. So you've already started, you might be stalled, you might have some questions. So the Q&A workshop is really more for those that have started their registration and just want to clarify some bits. Then the registration window closes at the end of October. it goes to the Professional Development Committee in November, and assigned to assessors, and then we have the month of November to go through all the assessments and go back to the committee for our with our recommendations for sign off. So everything is signed off. One assessor assesses it. We have to complete an assessment form, and then that gets shared to the rest of the professional development committee, who go through our assessments to sign off. I am going to stop sharing now. How's it going? Did we have any questions in the chat, or has anybody got any questions? No questions in the chat. Has anybody got any questions? Anybody want to stick their hand up and ask any questions? Or Bertha, have I missed anything that you feel is relevant? Oh,
I
so
think yes. So there are a couple of things. Some people previously have downloaded the old form. So please use the current form, which is when you apply from the hub. Sometimes it might be, overwhelmed. You might be overwhelmed. When I did it mine, I felt it, I have to finish it and I have to do it. From my experience, I would suggest to do it, step by step. And remember, this helps you not only for the professional registration, but it will help you to reflect on what you are currently doing, how could you be better, and and how could you be the best you can be. So it's an opportunity, and we are always there here to support you.
yes, and one other thing you'll find on the new application forms, and the new application forms are shorter than the old application forms. So if you started this a year ago and you continue to use that old application form, you're actually doing yourself a disservice, because it's shorter now. It's a lot easier. And in the new application forms, you will see the standards and what the competencies are. You'll also see a reference to the National Competency Framework. Some people have used the National Competency Framework. Some people use the NCF as, for their own skills development. We put it in there so if you are using the NCF and you've already collected bits of information and evidence through what you're doing with NCF, it just shows actually if you've already done that standard on NCF, it ties in, it matches this standard. If you haven't used NCF, ignore that column. It is purely there for a little bit of added extra help if you have done both NCF and you're doing registration. It just might help you not having to do something twice, because you might have already covered it. If you've never opened an NCF spreadsheet in your life, don't worry about it. It's not at all relevant. It's not connected to being able to do the professional registration. You can do the professional registration without ever having looked at NCF. But if you've done a lot of work with NCF, it might just help you bring some of the bits together. Alana, you have a question?
Hi, yeah. So hopefully it's an easy one to answer. I was just thinking about and I'm really sorry I was late in, so you may have already covered it, but just about the level to apply for. Does that ultimately get decided by whoever assesses it, or do we
No.
just go for whatever we
There
think?
is a matrix that's
Yeah,
available when you're going for registration that shows the different levels and what is expected of that level. It might be autonomous practice, it might be responsibility for yourself or for others, and there's different levels. So we put that matrix in there so you can look at it and think, oh, actually, I'm past being a practitioner. I think I'm a senior practitioner. Then if you look at the senior practitioner standards in in anger and go through them and think, actually, I fit advanced practitioner for a couple of those. Unless you can do advanced practitioner for every single one, you have to go with senior. So you have to be able to comply with every standard at that level. We have had an instance where somebody had applied at a senior level and the assessor went through it and decided they were actually worth an advanced practitioner level, and they were awarded advanced practitioner. That has only happened once. But you know, if you apply for all the senior stuff and when the assessor gets your form, they're not sure about something, we want you to get through this. We are there to help you get through this. This is why we have the workshops. If I say assessed you at a senior level and I'm worried that you haven't evidenced one of the standards, or I'm not quite sure that what you've written really answers the question, I will email you and I'll say, look, you haven't evidenced your continued professional development. Can you just send me the certificate or the Eventbrite invitation to say you went to that workshop? And then you can send that on to me and I think, great, tick the box. Or I might say, I just feel you haven't written quite enough. I'm not quite sure, maybe in one of the healthcare contexts, that you really get how you fit into the system or your impact on healthcare. Can we have a quick call? And we'll put in a Teams call and, you know, I'll have a discussion with you and you'll say to me, yes, this, that, and the other. And I might prompt a couple of more questions and then I'll think, right, happy with that. I get it now. I'm satisfied. Tick the box and you're on your way. So, as you know, apply for the standard that you can answer everything. And if we feel you haven't, we will go out of our way to come back to you and cover that. So, Peter, you've asked, the registration window is open every quarter. So it opens 1st of October. The next one will be 1st of January. Also, just very quickly, Bertha has put in the chat a link to the feedback form. We haven't done this before. We want to start doing this to make sure that we're getting the most out of these sessions and that all your questions are being answered. There's only about 5 tick boxes on there. It's really not long. If you could just, you know, pop in and do that, it would be very much appreciated. So, Alana, have I absolutely covered your answer there? Yep. And
Yes,
Peter,
thank
you're
you.
happy
Thanks.
that you know every quarter, and these registration workshops will happen the middle of the month prior to the registration window opening, the middle of the month of that registration window month. So if you started your application, you can go into the next workshop to answer any questions if you're struggling or you're thinking, I don't know how to evidence this, or, you know, got any questions, pop into the middle of the registration month workshop and then it closes. So you have a month to submit. So October is your month. The next month will be January, but there will be workshops all the way through. And all our workshops are recorded and saved on the hub. So you can go into any one of them and have a listen back and have a look. And on the site, you know, there's examples of reflective practice. The slides are there, so you've got everything you need, hopefully, to answer your questions. Anything else, anyone?
And I think there is an opportunity for you as well, for everyone, to come to our session on the 15th of October, because if you have more questions, it's like more tailored, and we can support you further as well.
Yeah. So even if you haven't started, you know, you might think, oh, I'll start in October, and you don't. But you know, you can still pop into that session even if you haven't downloaded the application. All the sessions are open for anyone, and it might, so Bertha's put the link in there if you want to register for that mid-month workshop. You can do that. As I say, well, as Bertha says, it's more tailored to specific questions for people who have maybe started their application. But even if you haven't started your application, you might learn stuff if you just sit in and have a listen. Oh, another question being typed up here. Unless you're just hovering in the message box and the little dots are going. No, if you have a question, do you want to just stick your hand up and say it? Or otherwise, I think I will assume that everybody's happy. So lots of link there in the chat then. The link to the feedback form, really important for us to make sure that we are answering your questions. A link for the professional register. So if you wanted to, the professional registration, and the Fed IP register link as well, if you want to see who's already on the public register. And then the link there if you want to register for the Q&A session on the 15th of October. But if everybody's happy and there's no more questions, then I think we can end it there. And you've got 2 minutes before your next meeting, potentially. Okay. Right. Thank you, everyone.
Thank you.
Jen.
Bye.
Right. Bye.